The Nigerian Center for Disease Control (Ncdc) has raised alarm over a surge in infectious diseases, with cholera deaths more than doubling in 2024 compared to last year. Ncdc Director General Dr. Jide Idris reported that cholera has claimed 378 lives out of 14,237 suspected cases, especially in flood-affected northern states. He highlighted the urgency of addressing issues like poor access to clean water and sanitation to summon threats.
The floods in the northern states such as Borno, Adamawa, Jigawa, Yobe, and Kano have exacerbated the spread of cholera, making these states the current epicenters of this outbreak. Earlier in the year, the cholera cases were concentrated in southern states as the rains began there, but we have seen a shift, with the northern states now accounting for a significant proportion of the cases. These numbers reflect the severity of the outbreak and reinforce the need for continuous vigilance and action. The control of cholera is more of a developmental issue. In situations where we don't have access to water, where hygiene is not fully addressed and environmental sanitation is not addressed, we will continue to have that. And that's why it's essential that this thing is emphasized.
Speaking further, Dr. Idris stresses that other outbreaks, including yellow fever, diphtheria, and mpox, are also being monitored, with mpox reporting no deaths from 102 cases.
So our response strategy rests on the several key pillars. In partnership with the MCDA and NAFDAC, we are facilitating the deployment of the 10,000 doses of mpox vaccine, prioritizing high-risk groups such as contacts of confirmed cases and the immunocompromised individuals. Priority states for this vaccination campaign include Bayelsa, Rivers, Cross River, and Akwa Ibom, based on the burden of mpox cases reported since 2017. Anyone with rash illness is advised to visit the nearest health facility for care, and the general public is advised to avoid direct contact with sick or dead animals, avoid consumption of undercooked meat.
He expressed concerns about Nigeria's inadequate public health infrastructure, while calling for improved sanitation and better reporting systems to curb the ongoing health crisis.
On Lassa fever, since the beginning of 2024, we have recorded about 1,018 confirmed cases of Lassa fever and unfortunately 172 deaths, with the majority of cases reported from Ondo, Edo, and Bauchi states. While the peak of Lassa fever outbreak was declared over in April, sporadic cases continue to be reported, with 37 new cases and 4 deaths recorded in the past month alone. These reaffirms that Lassa fever still remains a persistent health threat, particularly as we approach the dry season and when cases typically surge. To mitigate this risk, we are strengthening our preparedness for the oncoming Lassa fever season. We have reviewed our response to the previous outbreak. We've identified lessons learned to enhance future interventions. Our findings have identified that kidney failure as a major cause of death from Lassa fever. In addressing this, we are training health workers at both the state and local governments. These trainings are ongoing to ensure rapid case detection, accurate reporting, and effective management.
Vincent Okushin, QTV News, Nigeria.